questions, and I think it really comes to the evidence base of what do we have as far as testing in children. So if you look across all of the tests that we've done and when we have the age, the portion that is then the lowest tested portion is the under 10-year-olds. So we're putting into place other ways to get testing results from them and looking at antibody in that discarded samples and try to really figure this out, because parents have really done an amazing job of protecting their children. I think Americans have done a great job in keeping infection rates low in children and in the sheltering time, and keeping infection rates right now in this new cases. Originally, I think we saw great protection of people with comorbidities. We are worried now that as cases spread, that it's getting to the older parents and the grandparents. And I call on, again, every multi-generational household, get tested and protect those in the household. And we do know that there are children with vulnerabilities, and certainly within the CDC plan and Department of Education, it's protecting those children also from getting exposed to the virus, because we do know there are children with comorbidities. We know that there are children in America with cancer and undergoing chemotherapy. But when you ask that question, the parents have so protected their children. And remember, early on, we said test if you have symptoms. And now we know that if you're under 18, the majority of you don't have symptoms. And so really figuring out, and there's universities working around the country on a saliva test. So it would be easier for children to put saliva in a tube, just basically what we call spitting in a tube, or spitting through a straw into a tube, and looking at that kind of innovation and testing. And what Admiral Giroir has been working on very hard is this antigen-based testing, and getting that equipment into both vulnerable areas like nursing homes, assisted living, and other places, but also considering how a school district could use that would make it much easier to test and to use saliva. So all of those are being worked on, and it's why we've been pushing on the antigen test. I know you heard me talk about that in April. We're pushing on that because we think it is important for testing of students and testing in universities. But we have our data is skewed originally to people with symptoms and then skewed to adults over 18. And so we are looking very closely into that category by using our antibody tests.
Did you want to talk about the risk to children?
Oh, I think the Vice President covered that incredibly well. We know that mortality rate in under 25 from the CDC data is less than 0.1%, and so that has been holding. But until we know how many have been infected, we have no evidence that there is significant mortality in children without coexisting diseases. And that's what we're looking for right now, is to really make sure we've overturned every rock and understand that in deep detail.